The chair now recognizes for 5 minutes the gentleman from North Carolina, Mr. Walker.
Yes. Do you need another minute to kind of go into detail, or are you satisfied with that answer?
Congressman, when we had this decision that we had to make last week, it wasn't 1,000 people, it was about 200 at our Seattle office. We took into account what the local authorities were doing. That was part of our decision-making process. We will adjust our decision-making based on what is going on in the particular community at issue. Would I have less reluctance in agreeing with Dr. Fauci if we were talking about Seattle? Yes. Than if we were in the middle of, an area of a state that was not experiencing interruption?
Absolutely. It's subjective. I know our Democratic governor just ruled that the NCAA tournament there in North Carolina should move on. So some of this could be geographically influenced. Would you agree?
Absolutely. And again, depending on what is going on in that local area.
What procedures do you have in place? Specific question here. I was recently in the Rio Grande Valley border. Over 60 different countries, or migrants from 60 different countries had been apprehended. This year alone, I believe several hundred Chinese nationalists have been apprehended as well. The procedures in place, if you arrest a migrant that is showing signs of respiratory problems, how do you handle that? Do you separate them or isolate them? What's the procedure in handling this?
So we have, prior to the existence of this virus, in place standard operating procedures because we do confront communicable disease on the southwest border with a certain degree of regularity. Those folks are transferred to ICE. They have quarantine procedures. If that is not available, CBP is in a position of having to rely on local healthcare systems to provide that support. Those are the two avenues we have.
Appreciate that. Dr. Redd, thanks again for your long-term service. Appreciate what you're doing. There are reports that there are 2 strains of this virus. If the virus continues to mutate, does this possibly slow efforts to develop a vaccine or contain it in other aspects?
Well, viruses that are have the genetic material as ribonucleic acid, when they naturally mutate. It's in fact when we do sequencing, you actually get a bunch of different viruses, and there is a consensus sequence. So I think that they just naturally mutate. I don't think we can predict what will happen with the virus. It would be unusual for there to be enough mutation that a vaccine that we would produce against a strain now wouldn't work because of that kind of drift.
We had a very strong presentation yesterday in conference from Dr. Scott Gottlieb, who was pointing out the fact that he believes, in his opinion, that this will slow down in the summer or dissolve a good bit, but have maybe potentially a small spike back in the fall. Is that what you guys are seeing as well?
I think we hope that in the summer we will see a drop in transmission. I don't think we could say that we know that. That what you're describing is what happened with H1N1, where we had a fall or a spring wave. Things went low in the summer, still had more flu than usual in the summer, and then in August and September we saw a big increase. I think that does, if that were to happen, it would be a great thing because it would give us time to be more prepared for that fall wave.
Right, and traditionally the flu follows that pattern. Is that correct?
That's true.
Okay. We talked about it already. The World Health Organization has now listed this as a pandemic. Does that modify you guys' approach or change anything as far as the way you're moving forward with it?
It really doesn't. I think what that declaration was something that people working in this already knew, that it's around the world and there's lots of community transmission around the world.
Okay, thank you. We'll get time for another question with Mr. Cuccinelli. Do you have a plan for FEMA should an area that is the center of an outbreak, we were just talking about geographic and maybe demographics as well, if there is an outbreak that could be considered maybe the natural disaster, how does those two connect and what is your role in this?
So you're probably familiar with our IMAT teams that get deployed. For instance, Tennessee just had devastating tornadoes, and FEMA deployed its IMAT teams and then followed up with support. What we're designed around at FEMA is fairly large IMAT teams to respond to a natural disaster as you described. But here we can and are seeing eruptions all around the country. So what FEMA has done is they've broken their IMAT teams down into smaller teams, so there's at least one for every single state and territory. They're smaller, 4 or 5 person teams. They've been trained specifically to support states and local officials under these circumstances, obviously different from a natural disaster. So we've adjusted our personnel. That's what we've been doing with some of this time is changing our setup, our structure, and our ability to reach out and more quickly support states and local officials in that capacity. If a local area is overwhelmed, if they have systems overwhelmed, at that point, they might request FEMA assistance on a more traditional basis that you're used to. I would note the Stafford Act isn't really designed for this sort of situation, but there are analyses of that going on right now.
Thank you, Madam Chair. You're back.